Well, we know in general when we do have poor air quality events, we will see more hospital visits, emergency room visits, use of medications for people with asthma. It's too early to say in terms of specific numbers with this event, but that's something we do look at, and we'll keep track of that as things move along. People may remember a few years ago we had an event in August in 2015 that lasted for near a week. But this is into that same range in terms of the potential health effects of poor air quality. So if people have heart or lung disease, they may notice they get an exacerbation of those symptoms: shortness of breath, eye and throat irritation. People with asthma, any pre-existing condition, should make sure they have a good treatment plan in place, and then pay really close attention to their symptoms. If they notice any shortness of breath or anything that's really concerning, they should speak to their healthcare provider, call HealthLink at 811, or if it turns out to be a really severe situation, then look at going into an emergency room as they would for any other type of condition. Well, masks can be effective if they're properly fitted. The problem with masks, though, is that they can increase the work of breathing, and especially when it gets hot, then that can be quite challenging to keep them on and use them. So our main recommendation for people is to do what they can to get out of the poor air, get indoors. If people have access to air-conditioned to facilities, to use those, use public facilities that are well ventilated and air-conditioned. And the more pollution is in the air, the more potential risk there is. But that does need to be balanced as we go forward into the week. We'll see varying air quality conditions. People still need to go about their business, and there are benefits obviously to being active and being outdoors. And so today, when it's really in the high and very high range, this is a time when people might want to think about rescheduling and avoiding strenuous activity outdoors, particularly if they're in a high risk group.